Hey everyone, this is Lynn Schrader here from our office in Fort Dodge, and I've also got a couple agents here in the room with me as well, so welcome. And you guys know you're always welcome to join us here in Fort Dodge if you care to. This morning we're going to be talking about health reform updates. This is our monthly conference call to really bring everybody back up to speed to see what's gone on since the last time we visited. So let's jump right into the presentation this morning. By the way, I am recording the conversation, this call, and we'll get it posted on our website. So if you need to drop off early or you've got some folks you know, friends you know that maybe weren't able to join us this morning, we'll have this on our website. So these are our updates for the Patient Protection and Affordable Care Act through October that we know of, at least up to this point in time. So I want to jump right in and start first talking about training to make sure that everybody's up to speed on what the expectation is for marketplace training, and then we're going to cover a little bit about product training with the different carriers. So the first thing I want to make sure you know about is to make sure that you get your online marketplace training. There's the actual link that you need to go to do that. If you haven't done it, please make sure you, once you complete the training, that you print your certificates and send them to Nicole. Nicole will go ahead and get those sent off to both of the carriers that are operating inside the exchange. And she does ask that you send, there's one form that has a little like green bar across the top or something kind of official looking. I might call it a watermark, which I don't know that it really is, but that's kind of how I envision that. And there's another one that you can actually print that doesn't have that on it. Why don't you go ahead and print the one that has, I think you get it off of the curriculum button on that website. Print that off and get them to her. And that's what one of the carriers wants. It's either Coventry or Co-op, and the other one doesn't really care. But let's get those printed off if you haven't yet, and get those to Nicole, and she'll get those sent in for us. And then don't forget about the next step once you've finished, and that's the enterprise identity management. And I have to tell you guys, this is where I'm hung up. I have not personally gotten my FFM ID yet because I'm still waiting on verification. Yep, and Gary, you're saying the same thing. So, so hang in there. I did send an email to technical support, so I'm trying to work through that myself to make sure I get that. So we can't submit business, obviously, and get paid on it until we have that number and that verification. So then we'll use our NPN number as well as it's the Federally Facilitated Marketplace, which is the FFM ID number that we need. And the portal that you go to do that is also listed there for you, just as a reminder, okay? So make sure that you get that taken care of if you haven't yet. And then let's talk now about product training. Isn't it interesting how this stuff just has been evolving? Because when we heard about, Wellmark came out and did their product training in the August time frame, and we had those dates set up, and then Coopportunity said, we're going to hold off until right at the end of September to do our product training, and they did. And we all got these big binders if you went to classroom training to learn about their products and to learn about their network, and learn about any other innovative things that they're doing differently. So that was, and then how to use their quoting tools, and we'll get to that in a second. So, so knowing that Coopportunity has done their classroom training, their webinars they'll continue to do ongoing, and I think there's been confusion with many of us, and I will say I'm one of those as well, that they'll put out a webinar and you're not really sure what is that webinar. Where's the classroom training that I need again? That's that product training webinar versus how to quote webinar versus just tell me about Coopportunity webinar. There was one of those early on in August. So they've got a series of webinars posted on their website. Peruse that on their coopportunityhealth.com. By the way, they've also promoted the marketing materials that they've got out there on their website, and we're happy to help you guys get through any of this if you need help. You should have gotten, if you're contracted with Coopportunity, you should have gotten your login and password from them. If you did not get them, we have it. So ask Nicole or ask any of the folks on the agent team. We've got access to get you your login. Your password, we can generate a reset for your password. We won't keep your password, but we know your login, and then we can help you if you don't know what it is or you had it. We can ask to have it reset, and it'll send you a new password then. So all that's done at coopportunityhealth.com, and then you can log in at the broker portal. Okay. Now that's also the place where you would go to get your webinar information, marketing materials, etc. So if you need any help there by getting in and using the broker portal at Coopportunity Health, holler at one of our team members. The other comments I want to make is really I'll just say disheartening to many agents if you'll notice that next line that says no longer accepting contracting until January of 2014. If you haven't gotten contracting in by now, it's too late to be able to market products this last quarter of 2013. So continue to work with Nicole in our office to get your contracting put together. She'll get that submitted for you as soon as Co-Opportunity will accept it, but they have stopped accepting applications, if you will, for appointment with them. So at some point, I'm sure they had to say, enough, stop, we have to make sure we get everybody in the system that we've got so far, and we'll start up again in January. I also want to remind you guys that in January is the time that they will allow agents to move their block of business to a new general agency. And I think this is really, this is interesting, and I think really causes the general agency to provide you great service each and every day. And it's something that before this even happened, that's what KHI strives to do anyway. So I'm supportive of this, to give agents choice, and you should have had it all along. I believe Wellmark will get there eventually where they'll allow you a choice of who services your business, and you really do own it. So anyway, Co-Opportunity is saying that. So if you are currently with someone else and you wish you could be with KHI, then you'll have that opportunity to move to us in January. If you were one of those potentially mutual med agents that had their business and didn't get it moved in time, there was a very short window that a lot of mutual med agents had to not only make their Wellmark decision on where they wanted to land, but then they had to decide, do I want to keep my Co-Opportunity where it is with mutual med, or do I want to move it to either GBL or KHI or some other operation? And so some people got stuck maybe in where they are, and they didn't realize they could have moved. So again, hang in there. You'll be able to move in January of 2014. Work with Nicole, like I said, on getting that contracting into her. She'll hold it until Co-Opportunity is ready to accept it. Okay. Okay, and by the way, with questions and stuff, I think it's easier with a group. We've got over 50 people on the call this morning, and I think, so what we'll do is I'm going to go through the presentation. I know we'll have time for Q&A at the end, and then we'll open it up. So write down your questions if you have them as we go, and or comments, and we'll open it up at the end. The next thing I wanted to talk about here, in particular with Co-Opportunity, is generating quotes. There's been a lot of activity, a flurry of activity. If you were on Co-Opportunity's website a week ago and you were putting in some information to estimate a subsidy, because we're all frustrated, we can't get onto healthcare.gov right now. Most of us can't. Some maybe are getting through. I still can't get through. Again, I've set up an account and I'm stuck at a place just so I can at least go in there and play with it and see what it's like. But know that the subsidy calculator had an error in it last week. They had a fix over the weekend. If you run a quote now versus what you did a week ago, it'll be different. And I think to protect us, you need to be saying we're using this site only as an estimator until healthcare.gov is up and we can actually apply and we get the guaranteed numbers from the government in terms of what a subsidy will be. Okay. So again, I think Co-Opportunity Health is one of a few places that are offering the subsidy calculator. I have to laugh because somebody said, well, I can find a subsidy calculator on Co-Opportunity's site, but Wellmark doesn't have one. Well, why do you suppose Wellmark doesn't have a subsidy calculator? It might be because Wellmark's not participating in the exchange, in the new marketplace. Why would they put a calculator on their website? So it makes sense to me. They'll probably have an estimator ready for 2015. If, in fact, they do decide to play, they have, as you know, verbally committed to participate in 2015. But, again, we'll wait and see what actually happens and gets signed later on in 2014. So make sure that you're using that subsidy calculator as an estimator when you're sitting with a client or visiting with them over the phone and trying to give them an idea. The plan comparisons, though, work great. I think you click compare so you can see what all the plans are. I think people have been surprised, and I'll just give you my take. I think the rates are higher than we wish they would have been. But I don't think we're all that surprised because we knew with the 10 essential benefits built in, with everything else we've talked about, I mean, rates are only going up. So not surprising. I think I'm seeing them very competitive to where Wellmark is. I've done some Coventry, also Look-See. It seems to be the rates are similar with all the carriers, and there might be some variances. I haven't run all the different scenarios, but at least I guess the way I look at it, I'm thankful that we have another choice in Co-Opportunity Health. thankful that we have Wellmark, thankful that we have Coventry, thankful that we have Co-Opportunity. Again, to me, it's still all about getting choice out there in the marketplace to help try to drive down costs. If we're not doing that yet, at least I think we are driving innovation. I'm seeing things come out of some of these carriers that I'm pleasantly surprised with, whether it's Co-Opportunity's 3 for free, their $100 gift card to go get your preventive exam and fill out a health risk assessment, to Wellmark's defined contribution plans, to United Healthcare and their small group market coming out with a real interesting platform on self-funded, down to very small levels of groups. So some neat things are coming in the marketplace maybe as a result of this. We'll wait and see. Don't forget that you still can enroll off marketplace with Co-Opportunity just like you can with Wellmark. Co-Opportunity is offering ACA compatible plans just like Wellmark is. And say, I want to throw something out there, and hopefully by the end of the call we'll get confirmation, but we just got wind, and we got it from someone we think is credible at United Healthcare, Golden Rule, that says they're not going to be offering individual plans in 2014 in Iowa. That means Golden Rule. I mean, it's United Healthcare, right, who purchased Golden Rule, and it's Golden Rule who's been offering individual plans in our market for several years now. I know they struggle at getting some traction. I don't know that their rates are as competitive as they need to be, but we will confirm that as soon as we get that, double and triple confirmed by United Healthcare directly. So we've got to call into our representative that we work with on the Golden Rule products, and we'll let you know. But that's disappointing to me. Again, we need more competition here. But don't forget, then there is that enrollment off the marketplace as well as on the marketplace. And today, to enroll on the marketplace, the only place to go right now is www.healthcare.gov. So just know that that's the place where ultimately you have to be. There might be some other portals out there. There's some of these web broker portals that are out there. There's only a handful, probably half a dozen or so across the United States. And those ultimately are still connected to the government and to healthcare.gov portal. So just know that that's the end-all, be-all. Co-Opportunity plans to have linkage on their site. So if you go to Co-Opportunity, your linkage can end up, if you qualify for a subsidy, click here and it'll click you through to healthcare.gov. That linkage is not available yet. And we'll talk about another linkage that's not quite ready yet when we get a little down the road here. Okay, so make sure we know that. And on the small group, hopefully you guys saw this, and if not, when it was wonderful, we had an agent actually call a couple weeks ago and say, okay guys, our small group quoting process is going to change. Now that we're starting to learn about how these carriers want to accept quote requests in the small group market now, KHI has developed a template. We'll send that out to you if you haven't seen it yet or gotten it. I think we did an email blast out about it, but we've got a checklist that's going to be helpful for you to collect the right data. We don't have to use the uniform applications, obviously, anymore from 1 to 50. In that small group market space, we want to use now this new Excel spreadsheet template that can then be uploaded. So our request to you is we will send you this. You get that completed, whether you do it or you get the employer to complete it. Then get that back to us, and we'll get your quotes pushed out to you. We'll get them uploaded, we'll get the quotes, and we'll email them out to you. So that's one of the services that we want to provide at KHI, where we always used to collect those uniform applications from you, and then get the quotes and then push them out to you. We want to kind of simulate that same process and still add that value. So if you have any questions on any of that, just give us a holler, and we'll walk you through it. Okay. All right. So let's jump on to Coventry. And Coventry's training, again, just got announced. So again, I'm going to repeat. We know that we had Blue Cross's Are You Future Ready training. That was Blue Cross's ACA product training. We had that, and you guys should have had access to that somewhere, even the Wellmark General sessions. That, by the way, we have required as mandatory that you attend. If you're going to sell Wellmark with KHI, you need to have attended Future Ready training. Then we have Co-Opportunities, which was classroom and now evolving into some webinar training on their products, networks, etc. We're requiring that as well. How can you sell the product when you don't know the product? So we are requesting that you attend that training, and now we're on to Coventry. So if you write your Coventry, whether you go direct, you go through somebody else, or you go through KHI, the KHI, obviously this came out, this is not GA specific now, this is just training. If you're interested in wanting to know more about Coventry products and selling theirs, finally, I think it was literally within the last day or two, the announcement came out. So here's their training. Click on the link, get registered now, and if you don't have access to that, give our office a call. We'll send you the link. So you can see the training, 2 training classes there in West Des Moines and 1 in Cedar Rapids, and that's it for now. I'm sure, I would guess they'll maybe do some webinars later on as well, but there are your choices for Coventry product training. And as I said, we'll confirm when we know, but at Golden Rule, we're concerned whether or not they're going to have products available in our market in 2014. So we have heard tentatively no products. So these are going to be the 3 main carriers in the individual market anyway, and then the small group market, of course, these 3 plus adding United Healthcare as well as River Valley. Okay, so now let's talk about the marketplace. Okay, so we've started to see it. I don't know about if you get the Des Moines Register, but I saw the Register article on last Sunday's paper, and there was a insurance leaders optimistic about exchange. And so it went through and it talked all about what's happening with the exchange out there. So I brought the paper in just as a reminder that, you know what, we kind of knew this, didn't we? I mean, we kind of knew with all the talk that it would have been, you know, a miracle perhaps that this would have all been up and running October 1 and been seamless. I think we were hopeful but also realistic. So we're starting to now see, though, we know that the issue is hardware related. We know from reports through the news that the government did not anticipate the volume of activity that was going to be on this website and utilizing these web portals. We understand that they had it built for maybe 30,000 users at one time to be able to access the system, when in actuality 250,000 people are trying to access the system simultaneously. So of course they're having throughput issues. But we know now that there is no broker portal in the health exchange. At healthcare.gov, there's not a broker portal. We know that if we're going to get credit for helping someone and we're using healthcare.gov, that we have to help them set up an account. We know now through our training that I cannot set up their login and password for them. I am not to know what their password is to keep the security there and keep the integrity there. I can help them get it set up. That then they also must have an email account. It even gives them some choices to set up a free email account. We have been told as well that we can use our email if we need to, because that if they said, fine, use yours, and you'll get the communication, but then they will go through and confirm the identity. I was setting my account up earlier this week, and I got a pushback that said something about Experian, right? We cannot validate your identity. Now, this is just me going in to set up an account, and yeah, it's somewhat fictitious because I'm not going to be buying on the exchange. I wanted to go through the process and see what it would entail. So anyway, just know that there's that step there, and that's the frustration, especially if you're having client meetings right now. Folks are coming into your office, you're talking to them about what you can do to help them, and you can't go any further. So what we're recommending to agents is make sure you put this thing off, you know, for sure another week or two, and I'm telling folks I wouldn't be scheduling any appointments till November to visit with folks. They've got time. Obviously, the open enrollment period goes till March, but if people are in old pool products, they're paying a lot of money, and they want help, they know they can get help, you know, you can fall back on the paper application. So we sent out, I hope you saw it, I got it directly from Jess Patton, and I turned right around and sent it out to you guys. We sent out the paper applications. I'm looking at a copy of 3 of them here. One is we're calling the standard form. It's probably the longest application. This is going to be used for families, so it's going to be more than just a single person. It's going to have a spouse or dependents, and it's going to be somebody that's pretty sure they're going to need a subsidy. I've listed there on the slide the federal poverty levels. Get comfortable with these. We've also got a little cheat sheet we're going to email out to you. In fact, I was just talking to Tricia before we started the call this morning, and we've updated it for 138% of federal poverty, because that's the cutoff for iCare, the old Iowa Cares program, now called Iowa Health and Wellness. We know now, and I'll talk about that in a future slide, but we know that that number is important for us to know, 138% of federal poverty, and then, of course, 400. So it's good to know if you're under 100, you're going to Medicaid. At or under 100% of federal poverty, you're going to Medicaid. If you're between 101 and 138, you're the new Iowa Health and Wellness program, where you're going to get some great assistance. This is the Iowa Cares program replaced. And if you're up to, anywhere in between there and up to 400% of federal poverty on a sliding scale, there's going to be some assistance. So know those numbers, but again, we've got a great cheat sheet. I'm going to go to the next slide and show you. This is what we've got for you. We'll be emailing that out to you. And also, and I'm going to show you in a minute too, if you miss our emails, and I talk to many of you, and I'm with you, we all get so darn many emails in a day. How do you possibly keep up? And you might see some KHI emails come through and you just don't have time to look at them. I'm going to show you a place to go on our website where all of our postings, all of our news flashes, all of our emails, are what we call our mass emails that we're sending out to all of our agents. Nicole has set this up brilliantly, where she then has them automatically post to our blog on our website, and you can go back and look at those. So, and you can even sort them, you can look, and so I'll show you that before we're done today, where you can go to get this information. When I tell you we've sent this out, we've already sent it, we're going to send it, you can go to our website and look back and see what we've sent. So we will be sending this out. So back to this whole paper application, and knowing some of these numbers, there's a standard form for somebody that you're pretty sure is going to need get a subsidy and they have more than one person in their household. There's a short form that's just for one person, and maybe, again, that they're not offered coverage from their employer. They may or may not need a subsidy. And then there's the one that says, this is another form that says, this is no financial assistance. I know that, but I want to go ahead and apply anyway. So I'm not getting assistance, but I want to apply. So anyway, we've got those 3 copies of paper apps. And I think Tricia quoted me the number this morning just getting it from the news, about 38,000 people have enrolled on paper apps so far. Now, when you think about the number, and I believe the number I heard yesterday was a potential of 7 million people that will enroll. We got a whopping 38,000 in with, about 5.5 months to go, right, of open enrollment. So we got our work cut out for us, but they've got to give us these tools in order to have this happen electronically. I don't know about you guys, but I refuse to do paper. But it's there in case you've got somebody that needs to do it now. They're going to leave town and be gone for several months or whatever the case is. The paper is out there. You can use it. Send it in. And when you use the standard form, you flip all the way to the last page, and it's Appendix C, and it says, for certified application counselors, navigators, agents, and brokers, and this is where you complete this section so we can get paid. You don't complete Appendix C, you don't get paid. So that's so important on the paper form as well as the electronic form once we can actually get to it. All right, so let me move ahead and talk now about the marketplace again with the IRS, making sure you guys are on board with this, because this is how we are providing our value to our clients to make sure they understand that the IRS will be validating and verifying the subsidy. Now, I say that with my tongue in cheek, right, because we've heard maybe this first year there is no validation. Then I come back and I hear them say there might be validation. So, I think the best counsel that we can give to our clients is then overestimate your 2014 earnings. If you're going to do anything, it will true up. I've had that question a lot too. Will it true up if we overpay? Will they pay us back? As much as we are skeptical about our government, the answer is yes, because it's done on your tax return. Your CPA will help you make sure this gets accomplished. So, so know that that's why a lot of times we'll direct them right back to their CPA, that know that the client can either take the monthly subsidy or take it annually, that it's their choice. Now, if they're cash strapped and cash flow is an issue on a month-to-month basis, obviously they're going to want to take a monthly. Then they're going to want to make sure that they overestimate their earnings so that they don't end up owing the government money at the end of the year because, oops, I made more money than I thought. Now I have to pay back some of the premium subsidies. Remember, too, on the premium subsidies, and I think Co-Opportunity's site displays this really well because it shows here's your amount you owe with your subsidy, here's what you would owe without. So it just helps with the math to show them that, in fact, I had a client we were talking to with an agent the other day and said, if you anticipate you're going to get a bonus, and by the way, anytime I speak to an employer group audience, I tell them, please don't bonus your people on December 31st. This could just entirely screw up what their estimate has been if they're currently getting a subsidy. But in any case, if you do end up getting an influx of cash, you've got to peel off some money and set it aside to know that I may end up paying and owing money on my tax return because I was underpaying my premiums all year long. So this whole issue of if somebody's going to get a subsidy, that could be a great thing. But I think we owe it to them to make sure they understand that this will be trued up in the end, in the end of the year. when you file your tax return the following, the following January, February, March, whenever. Okay. And then commission. This is a couple things I want to make sure you know, that we will be paid when our NPN and our FFM ID are entered on the application. And I don't know if you guys remember this, but I do, because I think it was probably 2 years ago this whole battle was going on about whether or not agents could even be paid. And so thanks to the National Association of Health Underwriters, thanks to the National Association of Insurance and Financial Advisors, those two groups, along with a lot of thanks to our Big I friends, the Independent Insurance Agents of Iowa, and of course the national organization, and lobbying efforts got us a place at the table, which got us a place to say people want to work with us. Do they have to? No. We know this. They can go online and do this themselves. We know that, and I've seen surveys. I think Wellmark did a survey. 68% of the population want to work eyeball to eyeball with somebody and still sit across the proverbial kitchen table and deal with some of these issues. So we are still a viable resource to them, and I think now more than ever. When you think about it, I'm going to go off script just for a second, but when you think about it, those folks, many of them will have 3 places to look to get to find a rate and to make a decision. If they're offered employer group coverage, they're going to be looking at what their employer is doing for them. Or if they're a spouse of someone who's offered employer group coverage, they're going to be looking, what will that employer do for me? Then I'm going to go maybe off marketplace and see what is a Wellmark Affordable Care Act, an ACA plan from Wellmark look like in 2014, and get a price on that. And then they might even say, what can I qualify for? What will my household income qualify me for a subsidy inside the marketplace? So there's 3 different places, and then what do we do with the kids? So there's a lot. You've got multiple players then in this family many times. So I think they need us now more than ever to navigate, no pun intended, where they need to go to get the best for their family. And so I think more than ever, we need to understand how the IRS works with the estimates, and then which portal might be the best place for them. Portal, I say, but it's off marketplace, on marketplace, or with their employer group. Okay. And we know, and I've said this, but I will say it again, that there's no broker or agent portal on the marketplace. We know now that we get paid by putting our NPN number and our federally facilitated marketplace ID number on the application. If a client is doing it without us, the line I like to use is, look, it doesn't cost you any more to utilize me. If you want to pursue this on your own and whatnot, then here's my number. Feel free to utilize it, and then you've got me as a resource instead of calling an 800 number in Lord knows where to get help with something when you can come down to my office. I still think that's our value proposition, is we're your local agents in your community. That's what we do. And even if we're in the state of Iowa, at least I can come meet you. I will see you. I'm a person. We can sit across the table. So even if you give them your number, they want to do it on their own or start it, give them. Take that Appendix C. Think about this. I just thought about this. I'm looking at Appendix C right now. Tear Appendix C off and fill it out and give it to people. What's wrong with that? Give them to your clients. Put it in the package you might give them and say, this is what will tie us together. You can do it on your own if you'd like, but I'm here as a resource, and I'm here even after the fact. When all of a sudden you get married, then what happens? You have a baby, then what happens? What do I do for all those other events that happen once I enroll? Now, the other confirmation that we just got, and I'm tickled to say this because as much as we know that our market in general for us as agents is not calling on Medicaid eligible people, we know that. And Medicaid eligible people at 100% of the federal poverty level, we direct them to the Department of Health and Human Services. It's DHS. Get these folks to DHS to have their Medicaid, get enrolled in Medicaid, and that's been a big push of this whole Patient Protection and Affordable Care Act, is find those people that say they don't have coverage today, they don't realize they qualify, get them into a plan so that they can go to a primary care physician and stop getting service and treated at a hospital when it's now really bad and really expensive, right? That's not our market, though. So, okay, dismiss that group of people. We're going to get them to the DHS, and they're going to take care of them. But what about the 101 to 138? You might also say to me, Lynn, that is not my market. You guys, let's go back to that screen. I'm going to go back for just a moment. Look at the 101, or just over 100% then, up to 138%. For a single person, somewhere between 11.5, we'll say, and 15.8. So who do you know that's in that market? It could be people that are in school. It could be somebody working a part-time job going to school, and they aren't necessarily your traditional college students. It could be, let's do a family of 2 now. It could be a single mom. The single mom, you guys, $10 an hour is $20,800 a year. If that single mom who's working 40 hours a week at $10 an hour and has a child, she will qualify for what used to be the iCares program, and she may not even know it. So I think it is important. I think we do have people in our midst that will qualify, and we don't realize it, that we can help them. So let me go back to this one. Agents will be paid. There was a question here. Why? Because instead of expanding Medicaid, do you remember the big argument that was going on in the Iowa legislature? The governor did not want to expand Medicaid. That would have meant sending people up to 138% of federal poverty into DHS and into the Medicaid program. And so together the legislature, and I had a visit with Senator Jack Hatch about this, and he said, Lynn, make no mistake about it, this isn't Governor Branstad's plan. This was a negotiated, compromised plan that both sides agreed upon. It really is Medicaid expansion, except that we're funneling these people through the health exchange. What's the benefit in that? They can visit with an agent, we can help them, and we can facilitate their enrollment through the marketplace. Now also know this, that if somebody's in iCares today, they will automatically be enrolled in either Coventry or Co-Opportunity's health plan, even if we don't help them. They will automatically be enrolled at the end of the year for a January 1 effective date, because the Iowa Iowa Cares program, being replaced by Iowa Health and Wellness, is going away at the end of the year. So Iowa Cares is gone. The new program funnels everybody into the health exchange. Do you remember we kind of went through this? If you play in the Medicare market, we went through this back in 2005 with dual eligibles. That same issue happened where there's somebody getting the subsidy, and how do we get them enrolled? You can help them, but they'll also be automatically enrolled. So interesting, kind of some similarities we see here in what we're doing in the under 65 market to what happened in the over 65 market. So you will be paid. That was the good news. I had lunch with Cliff Gold from Co-Opportunity Health this week, and Cliff confirmed for me, yes, it was never a question of whether they wanted to pay us. Co-Opportunity has our commissions built into their products. They will pay. It was a technology issue about whether or not it would go into, because it has to still be validated through healthcare.gov, in through the infrastructure, if you will, of our government. Would the government, between 101 and 138, knowing that these people are part of this expanded Medicaid program, if you will, would they send the information to Co-Opportunity Health? Co-Opportunity Health confirmed they will, through the technology, they will pass through Appendix C, if you will, okay? That's really what it comes down to. They will pass through our data and we'll get paid. So that, I know a lot of people had questions on that. Many of you agents, you know who you are. You have certain pockets in your communities of folks, they need help. The great news is, I think, that these are the folks that someday will pull themselves up by their bootstraps, and they will be out of the 138 of federal poverty, and they'll be on to that better job, making more money, and you were there at the beginning with them. So consider whether or not that's part of your portfolio of products or not, or a market, I should say, or not. Okay, so now let's talk about the law. Delay to employer mandate. The reason I brought this up, we all know this. You're like, Lynn, what? This is old news. Why are you bringing it up? I want to make sure that you're aware, because thanks to another couple agents who called me and questioned, the big question came up, not about the penalty, not about IRS reporting. We know those two things got pushed forward. That got loud and clear. But what about the full-time definition of 30 hours or more is defined as full-time? Know this, that remember the employer mandate, now I'm talking about the 51-plus market. I am not talking 1 to 50. In Iowa, in our small group market, and I don't know, and this was brought to my attention earlier this year, 30 hours has always been the definition of full-time employment. So in the small group market, if you were going to offer coverage, you had to offer it to anybody working 30 or more hours. Now that was small groups up to 50. 51 plus, they could define what full-time meant to them. Many large group employers, 51 plus, define full-time as 36, 38, or maybe 40. So they get to continue with their definition of full-time in their business in 2014. It's interesting because until this got pushed out a year, that's why many businesses were laying people off, reducing hours because of the look-back period, because they know that they didn't want to offer these people benefits in 2014 because of what it would do to their budget, et cetera, et cetera. I also want you to know, and I talked with Jeff Patton about this, I've talked to even some other legislators that have said, and I think we saw it in one of our industry rags that came out this week, that bipartisan legislation is in play to move that full-time definition from 30 to 40 hours, defining full-time as 40 hours in this 51-plus space. Think of what that can do to help our economy, and that's why there's bipartisan support, because both of them see, and this is why this gives me hope about this law, though it is not perfect, though most of us, at least on this call, don't like how this deal went down. It's here. So we've got to figure out how we're going to work with it, and let's fix the parts that are broken. And this is definitely a part that's broken and is being addressed. So I think most of us that are touching base with some of our political folks and representatives have said this most likely will pass in 2014. The legislation will be there to pass so that come 2015, when now the mandate's here, full-time will be defined as 40. So feel free to share that, and this is the stuff that you bring value to your groups when you let them know what's going on. Now, they still may be concerned about a look back, because keep in mind, if they're going to define it then as 40, then I guess it's not a big deal if somebody's working in 2014. But just keep in mind, be mindful of the look back period. If it doesn't happen, 2014 is a look back period. If this legislation doesn't get passed for some reason and 30 is still it, and I've got people in there at 35, that's my look back period, they'll be counted as a full-time going forward for 2015. The other thing I want to bring up about spousal coverage, probably since our last conference call, and we might have talked about it, but I just want to highlight it again. UPS, if you remember, came out and announced we are no longer offering spousal coverage. Now remember, separate those two. When you talk to your employer groups about this, or even individuals that are employees of large cases, make sure that you clarify, look, an employer may or may not offer coverage. They don't certainly have to pay for it. What the government is saying is we are not mandating that employer groups offer spousal coverage. That's your choice. We are mandating dependent coverage, however. So what does that mean? Remember and I think I'll get to this on another slide, but I want just to be clear here, if they don't offer spousal benefits, they could actually be doing their employee's family a favor if they're not covering a lot of that family plan or that spousal plan. So in talking to a group, you might say, and what is your position? What do you guys contribute to healthcare for your dollars for your employees? And many of them will say, we cover 50%, we cover 75%. Well, in just a second, we're going to reaffirm the 9.5% and what that is. But remember, whatever they do, they don't have to pay for, and some of them do, though. So again, if it's not offered, that allows that spouse to go into the exchange and get a subsidy because they are not offered group coverage. So instead of doing this, you know, gasp of, I can't believe UPS is doing that, they may actually be being helpful to their employees and their families because of what they're able or not able to do in terms of contribution to that spousal or family plan. We did get confirmation by both Co-Opportunity and Wellmark, child-only policies will be offered. And I should probably say Coventry as well, but I haven't gotten that confirmed as much as I know I have from Wellmark and Co-Opportunity. So this whole idea that what if somebody is offered group coverage, what we're hearing is it doesn't matter because they'll offer coverage, you'll pay regular rates. Here's the deal, right? If children are offered coverage, they cannot get a subsidy. That's not then just quote it off marketplace. Child-only policy off marketplace might still only be $100 or $200 a month, and that might still be a lot cheaper than a family plan. So again, this is why we are so valuable, because we are here to help them sort through this. By the way, Hawkeye is still in existence, the health insurance plan for kids in Iowa. It's still there, and it will be there. So remember, sometimes we still need to direct them based on income of the household, mom and dad or spouses. How much do they make? Their kids may still qualify for Hawkeye. That program will still go forward in 2014. So here's the subsidy eligibility. And remember, we know if someone is offered employer group coverage, they cannot get a subsidy as long as the plan offers those two components. The quality, it's at least a 60% actuarial value plan. If a group does not know what their actuarial value is because they're over 50 and they don't know, they're not being put in a bronze, silver, gold, or platinum category, they can find out either through their carrier or the Kaiser Foundation has a calculator on their website. Enter the variables of the health plan. It'll spit out an actuarial value. If you need help with that, see one of our account managers, somebody on our team. We can help direct you there so you can help your clients figure out what their actuarial value of their plan is, especially if they're self-funded. So check it out. Okay, again, if the quality is not there and if the affordability is not there, then of course people can qualify for a subsidy. So again, how do we define affordability? That's where the employee should be contributing, and I'm putting it almost in the inverse way. They should only contribute less than or equal to 9.5% of their adjusted gross income toward health insurance premiums. Now, we most recently have been talking to a lot of CPAs and just saying, get us a better definition of adjusted gross income and or modified adjusted gross income. I've seen it both ways. On most of the documents, I'm seeing modified adjusted gross income. And a CPA we talked to recently said, if you look at your 2012 tax return, 1040, it's line 37. There is the number that you will work with. So if you can tell that to your clients, in fact, I was talking to my sister on the phone who has a policy today. So we played with it and we went online. I looked at her. I was on Co-Opportunity's site. She literally pulled out her tax return and went to line 37 on her 1040. That's the number that is what we inputted in terms of her income to be able to calculate the subsidy. Now, here's the other question, though. Do you anticipate making in 2014 what you did in 2012? There's the question. Because I don't care if I got the right line on my Form 2012 and use that number, if that's not close to what I'm anticipating I'm going to earn in 2014, that's where I say what I said earlier, estimate on the high side then, so you don't end up owing a lot of money back in back premiums. So, no subsidies available if we're offered group coverage that has quality and affordability. That's quality and affordable. Employers might not offer spousal benefits, just like I mentioned with UPS. Maybe that's not a bad thing. When you sit down with your group cases, talk to them about the makeup of their employees and their employees' families. So, would they do their families a favor? Think about this. If a strong makeup of their employees are single breadwinner people or singles with children or maybe just a single breadwinner with children, they might be doing a favor to be able to not offer spousal coverage, okay? The other thing was interesting, what if you've got a group that offers coverage and they have a lot of family members at the top, let's say. So they definitely want to offer a group plan. They've got kids and spouses and grandkids or whatever the case is. They may intentionally offer unaffordable coverage. And now I'm really talking to you guys in the under 50 market because we know there's penalties for those employers that are 51 plus. But just think about this for a moment. Those small businesses, which we all have a bunch of them, they may intentionally say, you know what, I'm going to make my folks pay 10% of their adjusted gross income. So I become unaffordable. Why would they do that? There might be some highly paid people at the top and a big gap between the next group of employees that might be non-family members and that might only make 10 or 15 bucks an hour. If you've got that division in what I might call labor, right, skilled labor versus unskilled labor, however you want to class it, if you've got that, you may be doing them a favor because you offer coverage and you're doing that for other highly paid or family members, but you're making it just unaffordable enough based on what you pay your people that they can then go into the exchange and get a subsidy. So see how this is why I think we are, again, so valuable in what we can offer to them to help them leverage this, not only for them, get the tax-free benefits of being able to offer it on a group platform, but also help out their employees based on what they can afford to pay them based on their business and what they sell and their value proposition. Make sense? I hope. I'm seeing, yes, your virtual heads are nodding. Okay. Okay, so some of the sales activities. I'm just doing a little time check. It's 9:45, so I want to make sure we leave out time for questions. But in the sales activities bucket here, electronic apps, make sure, we just sent this out. Wellmark has the URL for your website or a URL that you can email out to clients that will have your agent number tied to it so you can get credit. We are so excited about this that Wellmark has finally offered this and has opened it up. And even if it doesn't mean a lot for us this year, with Wellmark's verbal commitment that they'll be on in 2015 and or maybe we'll see some rates go in the direction that we need them to go in years to come. But this benefit of having the URL on your website or at least able to email it, I'm really excited about that. So if you're not sure what that is and you need help, give us a holler. Coventry's URL is available today. Not sure, I haven't seen, will it work, is it working yet if we were to use the new 2014 plans. I'm not sure why it would change. I just haven't done it yet, but just know that they've had it for years, actually, where you can get on their website and email quotes and have your broker number tied to it, and then have the client finish everything, and you're not touching it until they call you. The Co-Opportunity URL link, they have said it will be available eventually. They're hoping for first quarter of 2014. In the meantime, obviously, with the marketplace, if you're going to enroll people on the marketplace, as I said earlier, we've got to go to healthcare.gov. I want to make sure that you know that we provide on-site support. I've been doing this. I was just down in a community yesterday with an agent doing a health reform seminar for them, for clients, for community members, for anybody that they can get in front of to show their value. So I'm here to help you show your value in your community. We've been doing that over the last year, traveling around, both Brenda and myself, helping folks. We're still doing it now. I'm doing them on through November, believe it or not. So it's not too late, especially with people that have dug their heels in and think that this thing's going to go away. So if you are interested, please get with me and let me know. Let's get something on the calendar. Drive that interest. The whole goal is making sure the community knows you know health reform. And I just want to applaud those agents and many others that I've seen are agents that have put banners outside of their place of business, especially if you're on a corner, you're more of a retail presence where people drive by or walk by. They're putting banners up that say, we know health insurance, we know health reform, come in and get a quote, some of these kinds of things. Let us be a resource to you if you're interested in that. We've got some samples that we've put together for our agents. We can give you some estimates of what it costs to do that. But think about it. How about those yard signs? Put them out and say, come on in here for a quote. Have your health insurance evaluated. There's right now no restrictions like they are in the Medicare market on how we can advertise, seminars we can have, educational meetings that we can, or sales meetings we can put on. So the one-on-one client support, I've done that as well, where I will go with you to a particular client you think might be particularly ornery, need that additional help, and sometimes just flat out they need you to bring somebody else in. They value you, but they need to know there's somebody else behind you, and that's us, and that's me and Brenda. So give us a holler if that's something you're interested in. The other thing an agent asked me for and we provided is, Glenn, I'm starting to meet with employees. And you guys, more than anything, if you sell more products than just health insurance, how valuable is this to perform individual employee meetings one-on-one where you help them figure out what to do with that spouse, what to do with those kids, and oh, by the way, if you do investments, how about where you put your investments, and oh, by the way, if you sell property casualty insurance, you know, I can get you. It's building that relationship now at the employee level. I've had many agents go, oh, brother, now I'm going to have to sit with all these employees. I'm like, are you kidding me? I think it's a huge opportunity. So anyway, I put together a PowerPoint that you can use to sit down and do employee meetings, and I prefer this presentation would be doing a big employee meeting that would then incent them to sit down with you one-on-one. So if you'd like that, just get a hold of me, send me an email. And then our KHI agent website update. I'm going to go to the next slide because I think, yes, I did a cut and paste here. I want to make sure you know when you go to khiagents.com, and here's I want to point to something here. I think if my mouse is working, here it is. See the news tab right there? I'm pointing my little mouse on the news tab. When you click that, up will pop this. Now, it'll come in order that we've pushed these emails out to you. Instead of having that show you on the screen here, what I did is I went over to, and I'm going to get my mouse, see where it says Post Archives? If you scroll down far enough there, these are all by month. So what you'll see is everything we've done so far in October will be posted there. And then once it's full, it goes over into next screens, and it sits there in October. You can see so far I've got 9 emails we've sent out in October. So you can sort it by date. You can say, well, I think they might have sent this out in August. I'll look in August or September. And this is a screenshot, but if you scroll down, you'll be able to see it also allows you to sort by category. Healthcare reform is a category, you guys. So click on healthcare reform, and this is what popped up. It says today, here's our healthcare reform webinar, and if you scroll down through, you will see all the other emails we've sent out that are tagged with healthcare reform, like the applications that I talked to you about earlier, the paper apps that you can look through that has Appendix C on it that you might want to take a peek at. We sent those out. That would be under the healthcare reform category. If it has to do with Co-Opportunity webinars or something Co-Opportunity is saying, there's a Co-Opportunity category, a Wellmark category, a Coventry category. You got me. Okay? So use this when you're feeling overwhelmed. Ask your administrative assistant, if you have one in your office, to say, go here once a week, look at this, pull out anything that looks good that I need to see and bring it to my attention, okay? We're all doing more with less. We're all being asked to do that. How can we leverage our resources? And we think this is a great resource to you to use your time wisely instead of trying to pour through emails and look for stuff in your inbox, okay? The other thing I want to mention, I think, okay, gosh, this is, yeah, a lot of information I wanted to share today. So, so let's go with what's ahead. KHI Wellness Solutions, I want you to know that we have partnered with a wellness company. We are so excited about this. So when you get a request from a client of yours to say, do you offer a wellness program? I want to offer something. I don't know where to go. We are so excited about this that we will private label this, so it'll be KHI's Wellness Solutions. That's what it'll say on our website. You can privatize it. You can have your client privatize it. Talked to an agent the other day. Hospitals would be a great, great customer that you can go to. You may not even have their health. Maybe you have a piece of some business in there, or you'd like to offer them the wellness. What are they doing for wellness within their organization? And for a fee, they can, one-time fee, they can private label it. You work through us. We can help you with all the billing. It's a beautiful thing. So if you're interested right away, email me or call me right away. I'm trying to get an estimate of how many agents might be interested. This owner of this company, they're out of Indiana, would love to come to Iowa and do some continuing ed training, train us on how to sell this stuff and know what it is. So this can really be a great tool in your tool belt, okay? It meets the requirements, like I said, of low monthly PP per participant per month. So you might have a group of 100, but if only 50 people participate, the employer's only paying 50 on the 50 that are actually in the program. Unbelievable, robust tool with incredible reports. I'm so impressed with this thing. So let us know if you have any interest. Some upcoming dates. Don't forget, Medicare AEP ends December 7th. Remember, there's no more commissions on Coventry's First Health Value Plus plan. If you had recommended that to clients, no more commission after that first year, which is disappointing to say the least. I mean, we make so much money anyway on Part Ds, right? Then the KHI Grow Your Business Award Dinner. Don't forget about this. This is our annual incentive that we have on you growing your block of business with KHI. It's Friday, February 21st. I know Trish or Nicole, one of them, I think it was Trish, that just sent out the email most recently. It would be under the KHI category, by the way, under our news flashes of what we sent out about our Grow Your Business. That is a list of all of our agents that are growing their blocks of business, and we'll do this again next year. So if you're new to KHI, stay with us, and you'll see and hear more about this. But that's coming up in February, and we have a wonderful time there. And then PPACA open enrollment changes. Enrollment and slash changes. Remember, it ends March 31 for a May 1st effective date. It's closed then until the fall of 2014 for a January 1 effective date. And that, remember, that open enrollment will mirror the Medicare annual enrollment period or annual election period, right? October 15th to December 7th every year following. Remember, qualifying events will allow folks to buy insurance if they don't have it. So we were joking at a seminar yesterday. Not joking, but we were joking. You don't buy insurance. It's April now or May. You're diagnosed with some dreaded condition and you want health insurance, get married. Get health insurance, you need health insurance, get divorced. We were joking about it, and it's not really a joke, obviously, but seriously, you have to have then one of these events happen, whether it's have a baby, adopt a baby, get divorced, get married, move, out of the area. So anyway, and then the other thing is just get a job. I mean, get employer-sponsored coverage, and then you'll be guaranteed coverage as well. So interesting, though, but remember that part about that, we can't emphasize this enough because this is all about getting everybody in, right, getting in the boat. Reminder of the tools that are available to all of you. Again, I'm just kind of some teasers out here for more information. And let me just say this, you guys, I know I've covered a lot of information this morning, and as I told you earlier, this is recorded. It'll be out on our website later today. But if you can just take away one or two things from this call and apply it or take action on it, you're going to be steps ahead of anybody else in your community that's doing what we do, right? So don't forget about our KHI blog. That's our news flash. We've also got videos on there. That's where this recording will be under a video. We have our KHI HR Solutions. It has a neat newsletter, so if you are looking for that value add for your clients, and HR Solutions is an amazing tool. Ask your account manager about that. Electronic uniform applications for group quotes 51 plus. Again, we've got this. It's amazing, fantastic tool. So you get it filled out via web, online. We get it back. We submit it to all the carriers. We get your quotes. It's just easier than using that paper application and having to fax or scan an email application. It's a web-based electronic application for only those groups and 51 plus. KHI branded solutions, we've got a corner on our website where you can actually, if you're like, you know what, I should get a price on it. We've got great pricing for our agents to order some new pens. If you're having a seminar, or pads of paper, or a chapstick, or, I mean, letter openers, I mean, whatever it is that you need in the area of branding your business, we've got access to that as well, and we can help you get that order placed if you like. We've got a letter to your client template. If you have not communicated, we sent out the list of your clients under 65. If you don't have that list, let us know. If you do, think about sending them some kind of communication to get in touch with you, that you're here, you're the expert, you're here to help. I say that because, remember, Wellmark changed their AOR policy. I hope you guys got this. Initially, they said no changes in AOR. If you help somebody that has a prior agent and they're not in the business anymore, too bad. That old agent will get credit. Not so anymore. They've changed it. If you help someone move from a current Wellmark plan to a new ACA plan, you will get credit as long as two things, as long as it's not a direct Wellmark client and as long as it's not a Farm Bureau client. Everybody else, they will process an agent of record change, so you can finally get paid on that agent that maybe decided to bail on this business because he or she just didn't want to step up or just wanted to retire, and that's fine. But if their clients are sitting there and nobody's servicing them, you can now service those clients, and they will process an agent of record change. So it is maybe in your benefit to send a letter, let your folks know you're in the business and you're here to help them. Wow, okay, that was a lot, right? So I've got just a few minutes till 10, and I'm sure we can go over a little bit. So let's go ahead, and I'm going to use the raise your hand if you have a question and or do the chat. And I will watch for you so I can, I'm going to do my audience view so I can unmute you. I'm scared to unmute everybody, and in fact I don't think they let me unmute everybody. So let me see if you've got a question, and I see Susan does. And go ahead, Susan. I don't know if you have a mute button, Susan. I've unmuted your microphone. Okay, and I'm not hearing anything. Go ahead and type a chat question, maybe, you guys, if somebody has a chat question. I'm looking here. Waiting for a chat message. I'll look again at my attendance list, and I did unmute Susan. So, Susan, I'm sorry, I'm not sure why I can't hear you. Okay, I'm going to go ahead and anybody else? Whoop, go ahead.
I'm muted.
Anybody else have a question? Okay, I'll go ahead and mute Susan again. I got some feedback there, so I figured somebody was. I'm going to look for another hand that's raised. You can raise your hand. There's Paul Bowers. Let me see, Paul, if I can unmute. I got you, Paul.
Hey, good morning, Lynn. How are you?
Great, thanks. Great, thanks.
One question, clarification on the Wellmark AOR is, or a BOR for a group. The only way we can do that is if we move them to an ACA plan.
I'm going to go ahead and mute you now, Paul. To answer your question on the individual, if you think about it, in order to take somebody from a Wellmark plan today, and by the way, this AOR policy is in effect January 1, that we can now, when we write a new ACA plan, so in the individual market, we have to write a new ACA plan, and the AOR will take effect. Today, if I were to write it, unless they're taking them through underwriting, obviously that would be today's rules. You have to go through underwriting to do an agent of record change in the individual market under 65. So it's going forward, yes, you must sell them a new ACA plan because quite honestly, going forward, that's all that will be available. I'll unmute you here and see if you had any other follow-up.
Oh, unmuted.
Yes, I have. I meant specifically for group.
Oh, and you know what? I'm going to mute you again. Groups, as you know, with groups, we can still AOR. Wellmark still won't allow you to AOR a direct group case away from them when it's a direct case, unless there's really extenuating circumstances. And I'll tell you guys, if there is something, I want you to let me know. This is where we escalate and we go to bat for you. So if you have a really weird situation, let me know, because there have been cases where exceptions may be made. They are very rare. So if you have one of those, let me know. But otherwise, they won't process an AOR. But every other AOR will be processed, whether it's Farm Bureau or another agent on the group market. It does not have to be an ACA plan, obviously. So if you do that AOR now, quick, before you can get it then. I would suppose they'd still do an AOR even next year on those plans that are locked in, if you will. Hope that answered your question. Okay, I'm going to look for another raised hand and or a chat. And let's see, I got Guy Lowry. Guy, I'm going to try to unmute you here.
Good morning, Lynn.
Good morning.
Hey, I called CMA and they said that the FFM number is the same number or the same login what you use when you sign in on CMA.
Okay, great. I knew that they allowed you to, like, you submit one. It's not that they assign you one. You get to submit it, but I wasn't aware that it was the same, your login that you use. So thanks. Thanks for that. Appreciate it.
You're welcome.
Okay, I'm going to scroll on through again, see if I've got a hand raised here. And any chats, any more questions or comments? I'm not seeing any chats. Well, I've got 10:03, and this was, I don't know about you, but I get all fired up about this stuff. So if you think of something else, let me know. We'll do this again next month, and I know we talked about maybe doing them more frequent, but honestly, you guys, with as busy as everybody is, unless something's important, we push it out. We don't wait. As you know, we've pushed a lot of this stuff out, but we almost bring it back together. So this is an easier way for you to get your information. You can dial in once a month, and we'll review everything and bring everybody up to speed, okay? So I'll wrap it for today. Have a wonderful weekend, and we'll talk to you again soon. Take care. Bye-bye.